Hi everybody, welcome to Healthline. I am Gregory Zarin, and it's summertime. And summertime means t-shirts, shorts, flip-flops, but it also means turning off the TV, getting off your gaming apparatus, putting your phone down, getting up, getting out, and spending more time outside with your family. You know, our mission here at Healthline and your friends is to share with you what you can do to how to be in your life more. So be in your life. Leave the phone at home. I guarantee you that text will be there when you come home. So just spend more time outside. You're in the clean air, you're experiencing it, and the more you breathe in and the more you breathe out, the healthier you are. So make me that promise. I'll do it if you do it. Okay, good. I saw you promise me. Now, when you're outside, you're at the beach, you're in the mountains, you're doing a lot more, you're going a little bit faster. You may get sunburn, you may get dehydrated. Pay attention. And you also may get a cut. And the cut gets an infection, and then it turns into a whole thing, and you end up at the ER, and you have all these questions, and what happened, and what is this? Well, here's what I decided to do. I decided to bring you a family friend, and the best of the best from Adventist Glendale Hospital, Dr. Elizabeth Maslow, who was in charge of the conversation of infectious diseases. Doctor, how are you?
Fine, thank you so much for having me. Really appreciate it.
No, I love that you're here, and being a family friend, you are very connected to my twin brother Lawrence, and we'll get into that. Before we dive into the topic of infectious diseases, share with us your medical history and what brought you to this specialty.
Medical history started at UCLA Med School a long time ago. That was in the era when infectious disease were just becoming well known, namely HIV was becoming.
Which we thought way back then, HIV was a death sentence.
Well, way back then it was, actually. And so much has changed since then. It's gone from being pretty much uniformly 2 years until you were sick to now, if you take your medications and you're compliant, there is no change whatsoever in your lifespan. Your life expectancy will be as normal, and it's all about living positive.
And you said that right before we started, and I want to address that. What got you into this specialty?
I love the fact that we can apply our knowledge and we can actually take a situation where somebody's in a lot of despair and a lot of discomfort, treat them, and then they're good as new. Because we as physicians know that these infections are treatable, and we have the antibiotics pretty much in almost all infections to treat, then we can be there for our patients and reassure them, comfort them. When they're sick and they feel they'll never be the same again, we know they will.
You know, I said this in the open that, you know, we spend so much time outside with summer here, and we're more active and we're not paying as much attention, and somebody gets a cut. Can that turn into an infectious disease? It
can. It can, actually. We tend to see that more in patients, or not patients, but just the general population that are immunocompromised. But we can also get it if we're completely healthy, young, vibrant, nothing wrong, not diabetic rather, and we get a little cut and some organism, maybe some MRSA that's been sitting on our skin because we just got back from the gym,
decides to climb into there and create havoc.
Yes, exactly. And then some of the strains can be pretty virulent, so even though you put your Neosporin or your Bactine, if we still have that, then it can start to get a little bit of redness around it. You think you're okay, you go to sleep, and the next day it's all the way up to your knuckle. And
okay, we're going to stop at your knuckle. Okay, we're going to stop you at your knuckle. Take a deep breath in and a deep breath out. Get a glass of water, open the windows, and more with Dr. Maslow. And what you need to know about signs and symptoms about infectious diseases do not go away. Welcome back to Healthline. I am Gregory Zarin. The conversation today is all about infectious diseases. But before we continue that, Just some great stuff you need to know about Adventist Health Glendale. Did you know that Adventist Health Glendale is a top-ranking best hospital by U.S. News and World Report in Los Angeles and all of California? They were recognized for 5 categories of care. That's 5. Adventist Health Glendale is proud to continue to be voted the best hospital as voted by the City of Glendale's residents in the Glendale News Press survey. That's 4 consecutive years in a row. Thank you, Glendale. And Adventist Health Glendale is looking forward to making it 5. As I said, the conversation is all about infectious diseases, and joining us from Adventist Health Glendale is Dr. Maslow. I love that you shared with us that in the very beginning of your studies, the conversation of AIDS and HIV, it was a taboo conversation. People didn't talk about it, and as I said earlier, it was considered a death sentence because people didn't know. How amazing for you is it to be where we are today? And you said it's about just living positively. What does that mean, doctor?
It's the most miraculous change that I could have hoped to have seen, not only in my career, but in my lifetime. If I could have one wish now, it would be that everybody who's afraid to be tested and is afraid to have these conversations could realize that the stigma we left back in the 80s, we left so long ago. There is no reason anymore at all in this day and age not to talk about it, not to be tested, not to do everything that we can to protect ourselves from getting it, or if we suspect, to just have these conversations with our families, our doctors, our partners, and that would be the one wish. This stigma and fear of talking about this infection that affects everybody, can affect everybody equally, is a barrier around the world to getting the proper counseling before you contract the disease and treatment afterwards. You
know, I was doing some research earlier, and HIV and AIDS deaths are still in 1.5 million deaths a year. And, you know, I really love, and I will speak for all of us here at Healthline, the most important conversation you're going to have is about you and your health.
Yes.
And you have to talk to your partner, to your parents, and as much as the patient will have the diagnosis, we spend time talking about diabetes and cancer and, you know, stroke victims. We that are loving the patient are going through it too. Yes. So just have a conversation. Yes. And one thing I want to say though is, you know, the people for protection can take Truvada. It's a pill that prevents contacting. Absolutely. It's 99.9%. That does not mean going out and living your life recklessly. Mm-hmm. New statistics show that teens from the age of 15 up to 23, new cases are on the rise because they think, oh, if I take a pill, I'm going to be okay.
Yes. Yes.
And that's true to some level, but it's not fully true because there's so much more out there that you can get.
Yes, there is. Yes, there is. There's still syphilis. There's still herpes.
HPV, gonorrhea.
HPV, absolutely.
Chlamydia,
gonorrhea
everything
has become very resistant in some parts of the world. So one of the infections, when I said that almost all infections can be treated, there are some strains of gonorrhea now that are resistant to pretty much everything. So I think we have gotten a little bit lax as we've developed all of these HIV medications, and we need to still continue to really focus on education, and prevention is our main way to stay safe with all of these sexually transmitted diseases and other diseases as well.
Talk to your partner. Have a conversation with your partner, and if your partner doesn't know the intimate history of who they are being intimate with, hey, this is not going to work today. You know, we think that it's not going to happen to me.
Right.
And
yes.
You wake up in the morning and you're like, oh my gosh, look what just happened. So right. Final thoughts in regards to HIV and sexual diseases, doctor?
It is still, as you said, so important don't do anything in the heat of the moment until you have proper way to talk to your partner and to protect yourself. That's your number one defense. Do not be afraid to talk about it ever. Is the most important thing. There is no judgment, not now, not with any doctor that I know. There isn't.
Perfection, thank you. And here's my thought on that. If somebody's not willing to have an open conversation with you about their sexual past, get up and leave. Because they're not taking care of you. Why should you take care of them? More on infectious diseases with Dr. Maslow when we come back. Don't go away. Welcome back to Healthline. My name is Gregory Zarin. The conversation is all about infectious diseases. Joining us from Adventist Health Glendale is Dr. Elizabeth Maslow. So, Doctor, I love how passionate you were about the conversation of HIV and AIDS. Other infectious diseases, you know, one that is super, super common, and it affected my twin brother, is cellulitis. What is cellulitis? How does it happen? And what can we do to be preventative of it? Because I'm sure with cellulitis, there's a melee of other ones.
Cellulitis is an infection of the 3 layers of the skin and the 1 layer of subcutaneous fat right beneath the 3 layers of the skin. The most common way that we get it is we usually actually 2 ways come to mind. One would be a trip and fall.
Well, Lawrence. We're in Hawaii, we're going to the beach, and he tripped on the stairs going toward the ocean and cut his leg, and we thought, oh, nothing happened.
Yeah,
and
you skin your knee, so what? Well, how many times do we do that as kids? And in this particular case, something is either on the skin, just sitting there colonized at the time that the skin opens. Sometimes there's an organism, a microorganism that you can't see, that's in the sand perhaps or on the stair. At that introductory spot, you have your skin open and then your microorganism introduced into the skin. Now, the question is, why do we sometimes get an infection?
I was just going to say, why does it, is it kind of like the perfect storm?
It's kind of like the perfect storm. Diabetics tend to get infected more than non-diabetics.
Because?
They're a little bit immunosuppressed.
Okay.
Your immune system isn't working just as well as if you were non-diabetic. But you can be non-diabetic. Some people have problems with their circulation. Sometimes their arterial circulation isn't up to par, maybe from years and years of smoking or genetics. And so the blood flow can't get to the tissues and clear the infection quickly. Lots and lots of us have venous stasis, which is the edema in the leg, which you have great arteries, but you can't get the edema cleared. Maybe you've been sitting on an airplane for hours and hours, or maybe you've been up on your feet all day. So in a normal host, usually there should not be an infection, but it does happen. It can happen. And we don't usually know, unless there's a big cut or a blister or an abscess where something is draining, we don't usually know what the bacteria is.
Okay. Because bacteria can be viral, it can be fungus, it can be quite a few things.
Yes, the infections, the soft tissue infections are usually bacterial. Okay. When we get a common cold, for example, or we get influenza, that's an example of a virus.
Okay.
Fungal infections, if you prick your finger with a thorn, you can get a fungal infection, particularly a rose thorn. And then parasites are generally, they can be everywhere, but generally in the gastrointestinal tract. So what we're dealing with the cellulitis in this country is usually bacterial.
Okay, so let's use Lawrence. So he falls, bacterial infection, perfect storm, because Lawrence works out 3 to 4 times a week. We take spin class together.
Exactly.
He is so healthy.
Yes.
What
yes,
happened? Was it just a perfect storm that this was living here, this was going on, and boom, it just snuck right in?
It snuck right in, And when there's nothing draining and there's nothing to do surgery, sometimes you have a little abscess and you can put a needle in a doctor, not at home. This is not a bathroom surgery type of procedure. You do more harm than good that way. But a doctor under sterile conditions can put a needle in, get a little bit out, and find out what the organism is. In Lawrence's case, there was nothing. It was just hot, red, painful, and swollen. So we started oral antibiotics first, which is what we do at home. You go to the urgent care, you go to your private doctor.
And don't self-diagnose either.
Don't self-diagnose, because a red leg is just that. It's hard to know. Even I've been doing this for 25 years, and I oftentimes have a hard time knowing how much is just swelling, how much is true infection. So we usually start with oral antibiotics. Now, if you see that your redness, which is usually, you can draw a line around it if it's just cellulitis, but if the redness starts going upwards,
which you were saying
or
earlier,
downwards,
climbing up the finger.
yes, then you know that it's going into the lymphatics.
Okay, so something going up, is it a line or is it just a streak of red?
It's a streak of
Okay.
red. It's very subtle. You might feel it before you see
Okay.
it. And it does not actually have to be there for a cellulitis to go into your bloodstream. But when we see that it's just either not getting better or actually getting worse, that's the time to call your doctor. Or if it's getting bad quickly and you're getting a fever, just go to that emergency room or that urgent care. Let the doctor see, because it might be time for intravenous antibiotics. The doctor may not always know which ones to start first. So we may start a regimen, wait a few days, and then it's not getting better. That's pretty terrifying for the patient.
Sure.
Less so for the doctor, because we know what else we have to treat you with. And so in the cases that don't respond within 48 hours, then it's time to bring out our broader antibiotics. And that's what we did in this case. And on average, it takes between 5 and 10 days to get better with the cellulitis. A bad case will be maybe 7 to 10 days of intravenous antibiotics, and then followed, sometimes in very severe cases, you might need to go 2 weeks.
And it's just
total.
2 weeks, which...
It depends on how severe your case is.
Hold that thought. More with Dr. Maslow when we come back. Do not go away. Welcome back to Healthline. Hot off the press, Adventist Health Glendale just received its 7th consecutive A-grade patient safety score from safety organization Leapfrog Group, a hospital watchdog group. Congratulations to everyone at Adventist Health Glendale. The entire conversation today has been all about infectious diseases. And as I said, please hold this thought to our guest, Dr. Elizabeth Maslow. Doctor, thank you for everything that you're sharing with us. What are some of the signs and symptoms of cellulitis?
Cellulitis is when your skin feels hot, red, warm, swollen, and painful.
Is it after a fall? Is it after a puncture from a thorn? Is it after anything like that? Or can you get cellulitis just by sitting here?
All of the above.
Okay.
It's just one of those things. Sometimes you know where it came from, and other times you don't.
What are other types of infectious diseases such as cellulitis? Because there's many.
There's many. There's pneumonia and bronchitis.
Well, before we even started, 3 infectious diseases were ranked in the top 10 causes of death globally. Lower respiratory infections, 3.1 million deaths.
Yeah, that would be
that's
the
pneumonia, right? Okay.
Yes, we just had a serious flu season, and when we get influenza, it's miserable. We've all had it, we all know, but the most serious consequence is the bacterial pneumonia that can set in after. And the reason is the influenza comes along and it can impair your respiratory function. You're not able to clear your airway as well. It actually damages the little hairs in your respiratory
Cilia.
system. You're very good. And the staph or strep can settle down in our lungs. There are many other bacteria as well, but those are the most common after the flu. And I bet you that a lot of those deaths come as a secondary bacterial infection after influenza.
And this can happen to anybody.
You know, it's scary. The pandemics and the worst cases of influenza have actually struck the youngest, healthiest. That's why we see so many deaths in children, adolescents, the millennials.
Is that because their immune system is not as strong?
It's actually because their immune system is stronger,
Oh.
and it causes more inflammation.
Interesting. Wow.
And so that's why I really strongly encourage everybody to get their flu shot. I know that's a controversial area. A lot of people were very disappointed with the results of the flu shot this year. It wasn't very efficacious. It was in certain strains. We had more than one strain this year. It is always better to have it on board than not to have it on board. And it's just the one thing you can do to make your case
Be proactive
less severe.
with your health.
Yes, even if you do get it, then you can still have, in some cases, an attenuated, a lesser less dangerous course.
And then the last out of the top three was diarrheal diseases.
Oh, that's still here in
Okay.
this country, primarily around the world. We have parasitic diseases, we have cholera, we have just horrible cases of diarrhea. After the hurricane
Sure.
in Puerto Rico, terrible diarrhea after every natural disaster. Here in the United States, what we've really been struggling with is C. difficile colitis. Clostridium difficile comes from having your normal gut flora altered by taking antibiotics, or even something like Protonix can alter your gut flora. We all, not all, but lots of us are colonized, maybe 40% of us are colonized with the C. diffs, and when we have antibiotics given to us, then the ratio of the good bacteria to the toxin producing bacteria changes. And then C. diff has been, so many people have gotten that, and it is curable, but it does tend to come back, and patients really suffer from that tremendously.
How do we build the flora in our system? Probiotics?
Probiotics are very, very good. Just eating yogurt is very, very good. We try to minimize antibiotics. For example, when we go to the doctor's office, we used to always feel our visit was not worthwhile unless we came out with a prescription for a Z-Pak or some Levaquin. Times have really changed, primarily because of C. diff.
Got it.
We do not want to give antibiotics unless we're positive that somebody needs them, because if we give you antibiotics and it was a virus and you would have gotten better anyway, but now I've inadvertently given you C. diff, that would be worse than nothing at all.
Well then, doctor, with all that we're talking about, please share with us Adventist Health Glendale wound care program.
I'm so proud of our wound care program. I am an infectious disease consultant at the wound care center. We have several, actually. We have a new wound care specialist. He's fabulous. His name is Bill Khoury. We have a hyperbaric chamber, and we're able to have patients go to that on a selective basis. We have nursing staff that see patients in the wound care center and also on the hospital floors, so inpatient or outpatient, usually a combination of both. If people are coming out of the hospital and they want to prevent their wounds from coming back, they want to make sure they're gone and stay gone. So it's now we've moved our location down from the first floor up to where the old coronary care unit used to be. So now it's spacious with private rooms, with windows. We're hoping for televisions to be put back there, but we don't have those yet. So we'll just have to keep our weight short.
Bottom line, though, what I love is that Adventist Health Glendale, it's whole person care, and the conversation is, you know, to not take a wound lightly.
No.
Because it can turn into an infectious disease. It can turn into something more catastrophic, per se.
It can.
What are your final thoughts in regards to taking care of ourselves in regards to infectious diseases?
The most important thing is to be aware.
Love that.
To take advantage of any prophylaxis we can. If there's a vaccine for it, please ask your doctor about getting the vaccine. It can't hurt, it can only help. If it's not indicated, then the doctor will tell you when or who. For all of us need to take a look at our feet. We're all going to be out doing sports. We're going to have to look for athlete's foot. Look between your toes. Look to see if your toenails are too long, if your shoes fit properly. If you have a wound and it's just not going away, even if it's not getting worse, but it's just not going away, come on in and see your doctor, come to the wound care center, get it addressed. It should close up under normal circumstances within a week. If it's a wound that's been there for years and you feel that it just can't be fixed, it's part of you, come on into the wound clinic and take a look.
Because the worst thing you're going to do is say, you know what, you're completely fine.
Yes, and there's always something more we can do to better ourselves. I truly believe that.
Dr. Maslow, thank you. Thank you for this great conversation.
Thank you so much for having me. It's my pleasure.
And on behalf of my twin brother and me, we love you. So you heard it. Here's the best news. There's somebody at Adventist Health Glendale waiting for your call, waiting for your question. Infection, diseases, your health, it's a conversation. So have it with your parents, have it with your partner, with your wife, your husband, your family, your friend, and say, hey, can we talk about this? At the end of the day, the most important conversation you're going to have is about you and your health. So why not have one right now? Please find us on social media. I am Gregory Zarian. We'll see you next time right here on Healthline.